Welcome to the CT Educator Podcast. I am your host, Karina Hogan. I am a registered CT technologist with 20 years of experience and knowledge. I help new CT technologists level up their CT training so that you can become a successful technologist. I'm also a mom and committed to sharing my knowledge and expertise to help you build your confidence, know the CT basics so that you can deliver quality patient care. So let's get into it. Hello and welcome back. Wonderful technologist Karina here. So hope everybody's having a good week. It's very gloomy and very rainy here in the state of Illinois and in the city of Chicago. So hope you guys are having a wonderful start to your week. And let's get into today's podcast episode. So today's episode is going to be about patient centering. I think this is a topic that is not talked about enough when it comes to new CT technologists and how they set up their patients properly. So I feel that this is a really important subject to touch on, and we're going to dive in so you understand why patient centering is crucial, along with making sure that the correct amount of dose is calculated that is going to be administered to the patient. Okay. So a couple things. Why is patient centering important? Well, the importance of it is that we have dose modulation systems on every CT scanner out there in the country. So the purpose of that is that when we scout the patient, that the correct amount of CT dose is administered to get an optimal exam. Now, I know that in hospital settings, patient population and just patient conditions can make it very difficult to kind of execute that ISO centering that is, I guess, textbook per se. So as technologists, what we have to do is we have to make sure that we line up our patients correctly, make sure we're using that laser light effectively so that the system can calculate the correct amount of CT radiation dose. Now, you'll get patients that are contracted, patients that are combative, patients that are confused, have Alzheimer's, dementia, you name it. And you're not always going to get that perfect patient positioning where your ISO center is completely spot on and just freaking you nailed it, okay? Sometimes that's not the case. Sometimes patients, they are, not ideal and they're not textbook because you have a lot of patients who are in the elderly population, patients who have a lot of different medical conditions, and just patients that just don't want to have these types of tests because they've been through it, 900 freaking times. So it's really important that when you start out as a CT technologist or even a seasoned, experienced CT technologist, make sure that your ISO center is perfect per se. Not perfect, but just ideal that the system will calculate the right amount of dose. Because I'm going to tell you what's going to happen if you're lazy and you don't center your patient properly. And I use the word lazy because I've seen a lot of fucking lazy techs out there. So what happens is that you will get doses that are a lot higher that are exposed to the patient. And your physicist is going to get that report and be like, what the hell's going on at this facility? Why are these doses on this type of exam higher than, Jimmy John's exam over here on a different type of scanner? So it's super duper important that you optimize how you scan your patient. It is important how you set up your patient and your laser light. you have to make sure that you are centering and lining up your patient to that correct Z axis. Because as CT technologists, we always make sure that we level and center and isocenter to that Z axis, to the body of the patient. So that when you take your 90 degree and 0 degree scout, so if you do 2 scouts, some facilities only do 1, that you make sure that your patient is centered correctly and the system is calculating and optimizing, okay, the patient's correctly centered. Because I know there's newer CT machines out there that will give you like a green check mark or a yellow saying you have to elevate the patient or lower the patient. And if there's a green check mark, I know it exists on GE. I'm not sure on any other systems, that's saying that your isocenter is spot on and it is correct. So the system went ahead and detected that you centered the patient correctly and that it's going to modulate and calculate the correct dose. I can't tell you how many times I have taught so many technologists over the years that they don't care how they isocenter the patient. They're just trying to get the scan done so they can get the patient off the table and get the next patient done. Well, let me freaking tell you something, okay? That increases radiation exposure and dose to the patient. And you know what? We're all about making sure that we administer radiation in a safe, correct way, that you can't be fucking lazy and think that you're just going to get away with it. Sorry, but that does not fly with me. What I want you to take away from this episode is that when we do things correctly the first time, you're going to do it correctly every single time that you scan the next patient. And it's also very critical and crucial when you're doing pediatric patients that you center them correctly and make sure you level them to that Z axis. Now, there are cases where you can't do that and the patients are not ideal. What I say to that is use your best judgment and just do the best you can. Documentation is your friend, and that's how you can communicate effectively and saying, hey, this patient's not ideal. This patient, was moving all over the place. I could not get them to hold still. Doesn't matter how much tape you use or table straps or immobilization, items, whatever the case may be. But at least if you document, it'll give the radiologist a perspective that this patient wasn't ideal. And if you document, that will give the physicist at your site some insight on why that dose may be higher. Okay. So I hope this episode was a little bit helpful for you and kind of gives you a better perspective on making sure that you isocenter your patient correctly and that you execute that optimal scan. So, hope you enjoyed this episode and hope you guys are going to have a good week. I know I have to work later on in the week because I do work in a trauma hospital, and we are wrapping up with the cold season, and COVID is just running wild with the amount of cases that have risen lately. So, hope you guys are having a good week, and we will chat next week on next week's episode. So, have a good week. Thank you for listening to this podcast episode. If you would like to share your CT experience, have an interesting story to share, or need help in your CT training, please email me your questions at contact@thecteducator.com. Come on over to Instagram @thecteducator. My DMs are always open, so let's chat. Thank you for joining me on this podcast, and happy scanning.